The 41 million mark here in the U.S. this weekend, 41 million cases of COVID-19. After a slow and steady decline in the spring, cases have started to go back up during the summer. At least 16 states have seen a 25% increase in the number of cases in the last 2 weeks compared to the 2 weeks before that. And because of that increase in cases, the push to get the vaccine is stronger than ever. But with the push comes claims spreading on social media that thousands of people have died as a result of the COVID-19 vaccine. Our Verify team confirms those claims are not true. Senior investigative reporter Bob Siegel explains where the disinformation is coming from and how we know it's false.
Some viewers are writing because they're angry. They claim the government's own vaccine data shows thousands of people have died from taking a COVID-19 vaccine. And they say the media refuses to report on the real numbers. Others are just curious, like Terry, who says, my unvaccinated daughter-in-law says 7,000 people have died from a COVID vaccine. Is this true? Let's get you some answers. Our sources are the Vaccine Adverse Event Reporting System, the FDA, the CDC, and doctors from the University of Michigan and Baylor College of Medicine. First, the idea that thousands of people have died from COVID vaccines has been circulating for months on social media. The posts all claim their proof comes directly from this government database. It's called the Vaccine Adverse Event Reporting System, or VAERS, and it's set up by the FDA and CDC for people to report adverse responses and side effects from vaccines. So far, the database includes more than 7,000 reports of possible deaths linked to COVID shots. But there are a bunch of important disclaimers listed on the database, warning the reports can include incomplete, inaccurate, coincidental, and unverified information. That's because anyone can report anything in this database, according to Arnold Monto, an epidemiologist at the University of Michigan.
The VAERS system is set up to be open-ended. In other words, you can report anything that occurs after vaccination, but it doesn't mean that it's caused by vaccine.
For example, the database is filled with reports like this one. A patient who received a COVID vaccine while in hospice care for metastatic cancer, even though the patient's death was felt to be due to underlying terminal illness, not the COVID vaccine. That's why doctors say the VAERS database cannot be used to accurately count deaths that might be linked to the COVID vaccine.
You put this overlay of millions of people getting a vaccine, and so it's going to happen by coincidence that somebody may pass away from this other condition, and they just happen to have gotten a vaccine. That doesn't necessarily mean the vaccine caused it.
The database includes all reports of possible side effects and deaths, whether they're true or not. Just take a look at this. An actual report found in the database submitted by someone after receiving the measles, mumps, and rubella vaccine claimed an adverse event was alien abduction, turning green, super strength, and rage attacks. While there are thousands of reports of deaths in the VAERS database that mention COVID vaccines, the CDC says those reports can't be used to establish a cause and effect relationship without further investigation and study. And the CDC says it's been doing that. The agency's website says a review of available clinical information, including death certificates, autopsy, and medical records, has not established a causal link to COVID-19 vaccines. So does the VAERS database show thousands of people have died from a COVID vaccine? We can verify that is false. The database is meant to capture possible adverse events from vaccines, but it contains unverified information that isn't necessarily related to a vaccine at all. See something you'd like us to verify? Send an email to verify@WTHR.com.
And Bob tells us over 300 million COVID vaccines have now been given in the U.S., with 3 confirmed deaths linked to a vaccine. The CDC's vaccine task force says those cases involve blood clots that developed after people got the Johnson & Johnson vaccine. Based on the data, the odds of a death from a COVID vaccine are tiny, just 0.0018%.